Health Minister Terrence Deyalsingh is confident that Trinidad and Tobago would be in a state of readiness by February in preparation to potentially receive, store and distribute the COVID-19 vaccine by March. During a UWI Vaccination Forum on Friday, PAHO indicated that the COVID-19 vaccine should be available in the Caribbean by the end of the first quarter of 2021. Mr. Deyalsingh confirmed that this is the current information he has received and vowed to ensure this country is prepared. Sunil Lalla reports.
Over the past week, we decided to take, as we say in local parlance, take in front. Not knowing which vaccine we are going to get doesn't mean we can't prepare.
A determined Health Minister, Terrence Deyalsingh, says preparations are well underway to receive the COVID-19 vaccine in the first quarter of 2021. Although the Moderna vaccine is part of the COVAX facility for which TNT signed on to, Mr. Deyalsingh says there were some developments on Friday, with COVAX announcing additional deals to access promising COVID-19 vaccine candidates. It essentially means that all COVAX participating and eligible economies will be able to access doses to protect vulnerable groups in the first half of 2021. He says if this country was to receive the Pfizer vaccine, which is not yet part of the COVAX facility, TNT would be prepared to receive it.
That vaccine needs to be stored at -72. We have gone through our facilities and I'm happy to report that we have identified and isolated in country already 3 -72 sub-zero freezers. One at TPHL, one at Port of Spain, and one at Eric Williams.
Mr. Deyalsingh says 2 sub-zero -20 degrees freezers have also been identified at the Arima Hospital in the event that a vaccine needs to be stored at that temperature. He also gave an update on the building of a chiller for vaccine storage at the Cuba Hospital.
Board note to the North Central RHA, which will be the procurement agency for that facility. They went out to tender, and interested persons have already received their packages to build out the 2 to 8 degree chiller at Cuba.
The minister says Tobago has not been left out, adding that with minor tweaks, the chillers there would be ready to receive vaccines. Sunil Lalla, TTT News.
British Prime Minister Boris Johnson has today imposed a full lockdown on London and southeast England in a desperate attempt to stop a new coronavirus strain from spreading rapidly over the UK. After emergency talks on the virus mutation with his top officials, the Prime Minister cancelled his plan to ease pandemic rules for 5 days during the holiday. Household mixing will be banned in London and the southeast, and socialising restricted to just Christmas Day across the rest of England. Residents across the country were told to stay in their local areas. The Premier announced a new top tier of pandemic curbs will be brought in for the hotspot regions around the capital from Sunday, with all non-essential shops closing and millions of people ordered to stay at home. Persons entering Trinidad and Tobago would still need to be quarantined and provide a PCR test, even if they have been vaccinated for COVID-19 in another country. This, according to Health Minister Terrence Deyalsingh, is the current policy of this country until further notice. He said both himself and Chief Medical Officer Dr. Roshan Parasram have held discussions with regional and international experts and have made this decision based on the current available science.
Whether you will need a vaccination to enter Trinidad and Tobago is not one that we have a concrete policy on as yet. That will be developed as time goes along. At the start, I did say this is going to be a step-by-step approach. So the first step is that regardless of whether you are vaccinated abroad, you will still need a PCR test to come into Trinidad and Tobago.
Mr. Deyalsingh, meanwhile, reiterated that non-nationals would also receive the vaccine.
Under government policy, I took a cabinet note on January 2019, that our policy under public health policy is to offer public health interventions, including vaccinations, to every human being in Trinidad and Tobago.
The minister also pointed out that this country has submitted a draft of a certificate to PAHO to sign off on, which would mean citizens may have a separate vaccine record for COVID-19. The latest update from the Ministry of Health indicates that there are 19 new COVID-19 positive cases. Of these new cases, 1 is a recently repatriated person and 1 is from Tobago. The Ministry of Health says there are a total of 425 active positive cases today. The MOH also notes that of the 354 persons in home self-isolation, 37 are in the care of the prison system. The number of positive cases reported reflects the samples taken during the period December 16th through December 18th, 2020, and not the last 24 hours. There were no deaths. The figure remains at 123. 26 patients remain in hospital.